All right, I'm going to show you a couple of hands-on manual techniques that I use for the wrist and the forearm. So you know, if you have a wrist fracture, when they get stiff at the wrist, they can also get stiff in terms of being able to turn their palms up and palms down. So if you can't turn palms up and palms down that well, it can affect how stiff your wrist can stay, right? So when we think about wrist flexion extension, it's not just flexion extension, it has to do with the forearm as well. This is obviously an elbow, but elbows develop really tight supination and pronation, but also wrist flexion extension. So what you'll see a lot of times, people, sitting at a table and working on wrist flexion extension, and that's great. You'll see in other videos that I do. It's wonderful, but I also like to do it in a supine position. So come a little closer, and one thing I like to do is I'll put my fingers in between, right? And what it does is it allows me to control the wrist, right? And I can get really great, if I put palm to palm, if you come from this angle, yeah, put palm to palm, I can really get great wrist extension. So if the metacarpal's here and the carpal's here, and this is a radius and this is the ulna, I can put my thenar, crease, eminence, I can put it right here at the wrist, and I can push with one hand, push medially, so push it into the body, and my other hand, so we're going parallel like this, right? So relax. You have to pay attention to your angle and their arm, right? So you're gonna push parallel. So now where you feel the tightness, you can give, this is devil's in the details, right? A little bit more pressure here or here. So if I'm trying to work, he's tighter, most people are going to be tighter on the radial side, where your third, your second and third metacarpal meet your carpal bones, because the ligaments there are shorter, tighter, stronger. So they're gonna need a little bit more of a push. So you can kind of like angle your hand a little bit more to the radial side and give that a little bit more of a shove. So you're kind of shoving, but like twisting a little bit. You see it? Alleviate. Right? Now if I wanted to, if they're more stuck here, I can give a little twist more to the ulnar side. So it's about, do I put the pressure going radially or do I put the pressure going ulnarly? ¿Te sientes diferente?
Sí.
Right. So he can feel the push on the ulnar side, or he can feel more of the push on the radial side, right? You feel the difference?
It's different, yeah.
Yeah, it's different, and it feels, and then if I want to more, I'll use my thumb. And here, it's all shoulders. It's all shoulder. So my hands don't like have to work as hard, because I have to use my hands for other things. So that's one way of differentiating, right? And if you really want, if you want to loosen up the wrist, working forearm is going to be really important. Put a little bit of cream on your hands. You see people have hair. If you're dry and they got hair and you're twisting, look, he's already like, that hurts, right? That hurts. So you have to put a little bit of cream, and you can, when someone cannot turn their palm up, none of the skin, the fascia, the muscles, none of that is moving. And in order to get great supination, pronation, this DRUJ, the joint between the radius and ulna, they have to move, and then the joint up here at the elbow have to move as well. So a lot of times if you're stuck with not being able to get that little bit of wrist extension and flexion better, go to the forearm and just start to move the tissue. So I have one stationary hand and one movable hand. So my stationary hand controls the wrist and supports the movement into supination. But my other hand is moving all the tissue. Alleviate. So it should alleviate the tension. Shouldn't be sharp or anything like that. Should alleviate the tension. All right. And if you see, I'm holding and I'm gonna twist, and I'm using my body. Look at my feet. I'm twisting with my body. I move my whole body in one direction. and I'm gonna twist with my body. My arms feel good, my hands feel good, I'm protecting myself, and it's you're looking for like a fluid of movement so that it's not sharp for them.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.